Hello, my name is Carol Gilling-Smith. I'm the Medical Director at the Agora Clinic in Hove. November is Male Health Awareness Month, and I thought it would be helpful as a fertility expert to run a series of educational videos this week on male fertility health. So today's topic is sperm. What makes good sperm and what causes bad sperm? And what tests do I need to have? About 1 in 5 heterosexual couples will need to seek the help of a fertility specialist or clinic. And around 40% of the time, the cause of the infertility will be due to a male factor. So really, assessing the sperm from an early stage is a really important move to make. It takes about 3 months to make sperm, and you start to make sperm from puberty onwards. So it's not surprising that you can make a real difference to sperm if you know what's wrong and what you can do about it. The basic sperm test, which is the starting journey really in your infertility investigations as a man, is going to look at the sperm count, how many sperm there are in the sample, how well the sperm are moving, and what the shape of the sperm are like. So men make several million sperm every day. In fact, they make about 1,500 sperm every second. So there's a continuous production of sperm going on in the testicle, and we are obviously looking at the sperm count as a snapshot in time. So sometimes it's important to remember that if you have a sperm test and it's not quite right, it's worth repeating. But what we do with the sperm sample, we ask you to produce a sample abstaining for about 2 to 3 days to give us the optimum sample, ejaculating usually into a small pot, and we then put a little sample of that under the microscope on a slide. And the scientists in the laboratory, our embryologists, will look at how many sperm they can see, how normal the sperm is, and how well it's progressing forward. A normal sperm count has to be above 15 million sperm in every mil, and a typical ejaculate might be 3 or 4 mils. That's about half a test tube full. So if you've got a sperm count that's below 15 million per mil, we call that a low sperm count. Some men may have only 1 or 2 million sperm, and some may have none at all. So the count is a very important factor in determining your fertility. And it might seem strange that so many sperm need to be produced to give you a good chance of conceiving, but that's because of 2 other things. Not all the sperm move in the right direction. Some move sideways or backwards, and what we're interested in is those that move forward. So a normal sperm count should have at least 32% of the sperm going in the forward direction. And for natural conception, that's a very important factor, because you have to be able to progress the sperm from the cervix after intercourse all the way through the uterus and down the fallopian tubes. And the other important factor is the normality of the sperm. Only normal sperm can actually penetrate an egg, get into the egg to fertilize it. And during that 3 months of making sperm, a lot can go wrong. And the sperm's made up of 3 components: a head, and the head contains the genetic material, a mid-piece, I always call it the Mars bar, the energy part of the sperm that helps it move forward, and the tail, which further propels it in a forward direction. And if a sperm is in the wrong environment, it may not form properly. And about 95% of all sperm is not normal. It's got an abnormal head, or 2 heads, or 2 tails, or small heads. It just can't function. It won't get into the egg. It won't make an abnormal baby. And it does alarm men sometimes when they look at the sperm report and they see 95% abnormal, but that's fine. But once the abnormality rate goes much higher than that, 97, 98, 99%, that is a sign that you have suboptimal sperm. So there was a very interesting study in Denmark in 2012 where they studied the sperm in about 5,000 young men, average age 19. These were not men that had fertility issues, and only about 25% had optimum sperm. So that's, quite worrying really, but does that mean that they won't be able to conceive in the future? I don't think we really know, but what we do know is that if you're setting out to have a family, it's not a bad idea to get your sperm checked out quite early on. So we do 2 types of fertility assessments at the Agora. We do the basic sperm test, which is a good starting point, particularly if you don't have a fertility issue. And there we look at the sperm count, the motility, and the number of abnormal sperm. But particularly for couples who've been trying for a long time, or those who may have had miscarriages or repeated failed IVF treatment attempts, or for men who are in a same-sex relationship planning to go on the surrogacy journey, it's not a bad idea to have a more detailed analysis. And so we have an enhanced male fertility MOT, where we're going to look at the genetic health of the sperm and whether there are any other factors in the sperm that could be contributing to fertility issues. In the sperm, there is genetic material, and we have genetic material in all our cells. It's called DNA. And what we can measure in cells is DNA damage. It's called DNA fragmentation. Most of our cells repair that damage, so it's not really an issue, but the sperm cell doesn't have that chance to repair. It's got a 3-month lifespan before it's ejaculated. So knowing the level of DNA damage is really quite a useful tool, particularly when we're trying to find why fertility is not happening, why conception is not happening. And we know that levels of DNA damage in sperm much above 20% are really quite relevant when it comes to repeated failed IVF treatment attempts and miscarriage. Why do we have DNA damage in sperm? Well, during that 3-month journey through the testicle, there is the possibility of oxidative stress. Free radicals in the testicle department can actually cause damage as the sperm is forming. So just as the sperm has the ability to not turn out to be completely normal, this DNA damage is really important, because in the healthy embryo, we know that 50% of the DNA comes from this sperm and 50% from the egg. So we need to get it right from the start. When we dig deeper into the sperm test, we look at factors that might be causing that oxidative stress. And one of the factors is infection. Often you're not even aware that you've got any infection and feel quite well. But we've come to understand that the microbiome of the genital compartment is key to understanding sperm health. The healthier the sperm, usually the healthier the microbiome. So we run a sample of the sperm and we send it off for looking for infectious agents. Often they're common bacteria that you find in the gut that actually aren't really harmful, but in the wrong place can cause more sperm damage than ideal. And we also run that test on a small sample of urine. So single visit, 1 sperm sample, 1 urine sample, and we can get a lot of information out there. And we also measure the level of oxidative stress. Following that particular more enhanced test, we always have a detailed chat to you, usually it's a consultation, just to go through the results and see what can be done. Really important to remember that it's that single one snapshot in time and you can do something about it. So first things first, I always go through your lifestyle. Lifestyle history is really important. We know that good nutrition is really key, and if you're eating a bad diet, you're having too many saturated fats, you're a little bit overweight, you're having a bit too much alcohol, all that is going to play a role in damaging sperm. So well worth looking at what nutrition you've got there when you're looking at your weekly diet. I'm not very keen on high alcohol intake. I would always advise you to reduce that as much as possible. Doesn't mean abstaining completely, but really sensible limits to your alcohol, no binge drinking. High levels of caffeine are not very good either. Very easy to grab the coffee and not realise how many cups you get through in a day. We also look at your weight, because high BMI, which is actually quite common, more so potentially since lockdown, does have a damaging effect on the sperm health. So a healthy BMI under 25 kilogram per metre squared is a good starting point, and trying to do the exercise to bring it down, not crash dieting of course, trying to eat a healthy diet and exercise to improve sperm. And exercise brings me on to another point. There is a moderate level of exercise which is brilliant, helps you with your weight, helps you feel good, helps to take away the stress, and is perfect. But excessive exercise can damage sperm. So being in Sussex, we've got a lot of hills, and particularly during lockdown, everybody went out and bought themselves a bike. And I don't think it's a bad idea to cycle. It's a really good idea. But if spending hours and hours on the saddle, there's not only the heat that can damage sperm formation, but also the knocking and the bumps, and it's not great for the testicles. So just keep the amount of cycling to a healthy amount, 3 or 4 times a week for half an hour. Not a bad idea, but 5-6 hours a day, every day, it's not going to do your sperm any good. Heat, that's a very important thing. Why do we have testicles outside the body? Well, because sperm doesn't like to have the body heat. It needs to be a couple of degrees lower. So if you are somebody that likes saunas or really hot baths, I would advise you to try and not to have cold baths or cold showers, but just to take the temperature down. Don't put the car heater on if you don't have to. Simple things like that. Don't put your laptop on your lap next to the genitals. It's going to be damaging. They get quite hot. So if you're sitting on the train, don't put it there. Just put it on a table. If you're wearing tight lycra and doing, again, a lot of exercise, you're going to increase the heat of the testicle. We sometimes find that men have varicose veins, or they're called varicoceles on the testicle. They're just little veins that are a little bit swollen. You may not see them, but you may be aware of them. They're not unusual. You can see them in up to 15% of men. And sometimes they can be a cause of more sperm damage, higher DNA fragmentation levels. But also there may be some underlying health issues, and you know, this is particularly important here in November, where we're looking at male health. You know, can be that if you've got really poor sperm count, there may be an underlying health issue, which is why we work with a urologist, a male fertility expert at the Agora, Mr. Jonathan Ramsey, so that when we highlight some quite significant sperm issues, we can get an expert opinion, and Mr. Ramsey will always organise further tests, examination, and hopefully be able to find a diagnosis. So there are several reasons why a man may have a low count or no sperm at all in the ejaculate. First is he may have stopped producing sperm, so that's a deficiency in sperm production. And we usually discover that by running a hormone test and also by examining the testicle. The testicle is often a smaller size. But another reason might be that the sperm is just obstructed. It can't get out. That could be due to trauma in the past or past infection, perhaps an STD. Or there may be a genetic reason. We know that some men carry the cystic fibrosis gene, and that means that they have an absence of the tube that allows the passage of sperm from the testicle outwards. So generally, when we see a low sperm count, we organise a series of tests, and that will include a hormone test and sometimes tests for male chromosomes, cystic fibrosis, and also a test for Y chromosome microdeletion, because we know that there's, on this particular area of the Y chromosome, sort of the coding for sperm formation may be damaged in this particular deletion. If there are no sperm found, then the first thing we want to do, having established a diagnosis, is to actually see if we can get sperm directly from either the testicle or from the epididymis, which is the place where sperm is stored once it's been formed. And we can do this by a surgical technique called PISA or teaser. And we have two consultants at the Agora who carry out this procedure, Mr. Collada and Mr. Ramsey. It's done under anaesthetic, and it's a simple procedure. For a male gay couple who want to have a baby through surrogacy, I can't stress enough how evaluating the sperm properly at the outset is key. You're going to be focused almost certainly on other things. You're going to be wanting to talk about the donor eggs. Where do I find a donor? How do we do it? Where do I get a surrogate? And all those things. And those are going to be part of the discussion when we first meet. That's always part of my initial consultation. But what I find very helpful is if either one or both partners, depending on whether you both want to be biological parents, has done a sperm test, because that is really going to determine how the whole journey is going to go. It may exclude one partner. It may also allow you to have time to make some real changes to your lifestyle so that you can improve your sperm. So again, two options: just a very basic sperm test or a more enhanced test. I would always advise the latter. I would always advise you to have a more detailed analysis of the sperm if you're going down the surrogacy pathway, because if we wait until it hasn't worked, if we wait until that beautiful embryo has been passed into a surrogate and it hasn't taken to start looking for these things that may have caused the genetic health of the embryo not to be perfect, it's a bit late. So I'm very keen that we discuss sperm genetic health from day one. First thing we talk about, really. What's the sperm like, and can we improve it? Can we make it absolutely perfect before we use the sperm in the treatment process? So an enhanced male test where we're going to measure DNA fragmentation, where we're going to look at whether there are any infectious agents, whether the genital microbiome is 100% or whether we can improve it, is really, really important. In terms of supplements that can help reduce oxidative stress, I always recommend a combination of supplements. We need to make sure that during that 3-month journey to, from start to finish, that there are all the right ingredients there in the testicular compartment to help healthy sperm formation. So I will advise on usually a couple of different supplements, and I may also ask you to take a probiotic, because we know that probiotics are really important in normalising the microbiome in the testicle.